Why is alpha-1 antitrypsin vital for COPD lung health? Imagine your lungs as a busy city with tiny air sacs called alveoli where oxygen and carbon dioxide exchange. Now picture a team of defenders protecting this city from harmful invaders like pollution and smoke. Alpha-1 antitrypsin is one of those defenders. It is a protein made by the liver that plays a key role in keeping your lungs healthy. When your lungs face irritants like cigarette smoke or air pollution, your body's immune system responds by releasing enzymes to fight off these invaders. One of these enzymes is called neutrophil elastase. It helps break down harmful bacteria, and debris but can also damage healthy lung tissue if not controlled. That's where alpha-1 antitrypsin comes in. It acts like a natural shield, neutralizing neutrophil elastase and preventing it from harming the delicate walls of the alveoli. When alpha-1 antitrypsin is missing or doesn't work properly, these enzymes are free to cause damage. This damage leads to the destruction of alveoli walls, creating larger air spaces and reducing the lung's ability to exchange gases. This process is called emphysema, a major part of chronic obstructive pulmonary disease. People with a genetic condition called alpha-1 antitrypsin deficiency do not produce enough of this protective protein. This deficiency makes their lungs more vulnerable to damage, especially if they smoke or are exposed to other lung irritants. In fact, emphysema often develops at a younger age in these individuals and tends to affect the lower parts of the lungs more than the upper parts. Without enough alpha-1 antitrypsin, the lungs become less able to defend themselves, leading to symptoms like shortness of breath, chronic cough, wheezing, and frequent lung infections. These symptoms are similar to other forms of COPD but have a different underlying cause. Since alpha-1 antitrypsin deficiency is inherited, it can run in families. Not everyone with this deficiency will develop lung disease, but the risk increases significantly if they smoke or are exposed to pollutants. That's why early testing is important, especially if there is a family history of lung or liver problems or if symptoms appear at a younger age. Treatment options focus on preventing further damage. Avoiding smoking and reducing exposure to irritants are the most effective steps. In some cases, doctors may recommend alpha-1 antitrypsin replacement therapy, which involves infusing purified protein into the bloodstream to boost levels. Other treatments for COPD, like bronchodilators, inhalers, pulmonary rehabilitation, oxygen therapy, or even lung transplants, can help manage symptoms. Recognizing the role of alpha-1 antitrypsin helps explain why some people develop COPD even without traditional risk factors like smoking. It shows how genetics can influence lung health and disease progression. If you or a loved one have COPD, especially if it started early or runs in the family, asking your health care provider about testing for alpha-1 antitrypsin deficiency could be a smart move. Knowing your status can guide more targeted treatment and help protect your lungs better. In the end, alpha-1 antitrypsin is vital because it acts as a natural protector, keeping your lungs safe from their own defense mechanisms. When it's missing or not working right, the damage can add up quickly, leading to emphysema and COPD. Recognizing this connection is key to better prevention and management of lung health.